Hello and welcome to Speaking from the Hip, a discussion on orthopedic care. My name is Reggie LaRoche, Assistant Vice President at Baptist Health Orthopedic Care, and your host. Joining me today, we have two instrumental men in the world of orthopedics, Dr. John Uribe, Chief Medical Executive and Orthopedic Sports Medicine Surgeon at Baptist Health Orthopedic Care, and Dr. Tony Miniaci, also Orthopedic Sports Medicine Surgeon and Deputy Chief Medical Executive at Baptist Health Orthopedic Care. Gentlemen, thank you for joining me today.
Thanks for having us.
Yeah, it's a pleasure.
So let's just jump right into it. So Dr. Uribe, orthopedic care has been part of your life for over 30 years. What made you choose orthopedic medicine as part of your career?
So it's interesting because when I was a resident, or actually a medical student at Chapel Hill, I was in the University of North Carolina, just having the opportunity to rotate through orthopedics as a third and fourth year resident, I realized that part of the body, the musculoskeletal system, is what interested me. Just treating the athletes at Chapel Hill through the sports medicine program. So that's really what piqued my interest in orthopedics.
And Dr. Miniaci, tell us about yourself and your success and your career path in orthopedic medicine.
Yeah, thanks, Reggie. It really goes back, I believe it or not, used to be a relatively good athlete playing soccer when I was much younger. And then I had an injury that put me out and really ended my aspirations at playing soccer, so that after I decided to go into medicine, I'm from Canada, originally went to the University of Western Ontario in London, Canada. And there was a couple of world famous orthopedic sports medicine surgeons there that sort of took me under their wing. I started going to their sports medicine clinics with them as a young student, and then during medical school, and they encouraged me actually to go into orthopedics. So that was the beginning of it all.
Okay, nice. So when we talk about Baptist Health Orthopedic Care, and right now it's known, especially in the South Florida region, as a well-known center of excellence. What do you think lends that success, or how can the consumer know that this institute is very successful?
Well, I think a couple things that it's the comprehensive care, right? The musculoskeletal system is from your head to your toes, and orthopedics is basically the treatment of musculoskeletal disorders. So to be comprehensive, especially in a major city like Miami, you really have to subspecialize in the different joints and the different applications of the treatments of orthopedic disorders, and that's what we've been able to do at Baptist Health Orthopedic Care, is just obtain really top-notch orthopedic surgeons and physicians that treat the disorders in a very specialized way.
And Dr. Miniaci, and going along the same lines of the success here at Baptist Health Orthopedic Care, and your experience in your past health system, what do you feel that you can bring to this organization?
The first reason is the guy sitting to my left. We've been good friends for a number of years. And so that when he asked if I would be interested in considering this position, the opportunity to work with him actually was quite exciting. But then I looked at it, did my due diligence, and a number of factors came out. One is that the excellence of care that exists here in South Florida, especially with Baptist Health and the orthopedic program. And I think even though we all know that, it's a little bit of a sleeper when it comes to national profile, but I think that you can put this up to any sort of national program. The second thing that really interested me was the commitment that Baptist Health has to growing the orthopedic program, providing the resources that we need to actually elevate our program to national levels. And thirdly, I was really interested to see the commitment of the communities, not just in the Miami-Dade region, but also Broward County and Palm Beach County, in terms of the patients and local community, how engaged they are actually in the growth and success of Baptist Health. So that for all those reasons, I thought that this was a great opportunity, and decided to take the leap.
Right. Well, it's been a great leap, and we're definitely glad that you're here.
Thank you.
And I'd be remiss not to mention the relationships and the partnerships that we have in South Florida with our professional sports teams. John, can you talk to us about how that started, and from the consumer, how does that help the consumer make the decision to come to us?
Well, I mean, it started. I was a military officer at Tripler in Hawaii, and got recruited by the University of Miami, and it was the 1987 team when I first got here. They were undefeated, and it was a great experience taking care of them. And through Jimmy Johnson, I met Don Shula, and then was asked to take care of the Dolphins, and it just progressed from that.
Right.
But the bottom line is, with professional athletes, I mean, they represent the highest level of human performance, right?
Mm-hmm.
And so your ability or your success in maintaining their ability to do their job, to perform, I think is a good kind of exposure about what we do in orthopedics, and I think it really demonstrates in a way that you have that excellence of care behind you to provide that care that keeps them going. So in that way, I think the consumer then has more confidence.
Right. Great. Definitely a great answer. And to piggyback off that as well, Dr. Miniaci, that prestigious care that we do, let's say for those professional athletes, and John kind of alluded to it, but also from your experience, how do you think that also trickles down to high school athletes, the consumers, your regular weekend warriors, from your experience?
No, absolutely. And so John and I have very similar backgrounds. So I started off as well taking care of some university athletes at my original place of work, and then I became involved with the Toronto Blue Jays, and that in Canada, obviously in Toronto. I took care of a lot of professional hockey players, which then sort of catapulted into taking care of players from multiple teams, a lot of Olympic athletes in Canada, and then when I moved to the clinic, also taking care of some of the professional football players as their head team physician there. So what I've learned over the years is that the way to success actually is that you take care of those players even though they're at a higher level, but you take care of your community players, your high school athletes, your college athletes the same way. Right. And I think that that's what breeds success in your regular practice, because if everybody's treated the same way, then I think that you're likely to have a good and successful practice.
Agreed. And with success, we've been very successful thus far, and then you're just looking at the future, and you both together now coming together, teaming up. What does the future look like for Baptist Health Orthopedic Care? We're talking about recruiting some of the best doctors in the area, treatments, technology, so the question is to you both, John, I could start with you. What does that look like?
Well, that's why I brought Tony. I mean, his credentials speak for itself. He's a world leader particularly in shoulder and elbows, and in overall sports medicine. He's just an incredible asset to our growth in the North, and so that we can have that continuum of excellent care throughout the whole system. And so we're both committed to recruiting the best, not just the best trained physicians, but that they fit the mold of a great person, a great doctor. And that's really what has made our reputation exceptional, that we have great docs that are very well trained, but they're really just good people. And the same goes down with the staff.
Well, thanks, John, for the compliment. This is such an exciting and wonderful opportunity. And as I mentioned, Baptist has really committed to helping us not only recruit some of the best individuals, increase our academic focus, but grow the Palm Beach County, Broward area, and add to the Miami-Dade, and then integrate it all into one great Baptist Health Orthopedic Care.
Right. All right, so I believe we are out of time. Thank you again. This has been such a great conversation. Thank you again, Dr. Uribe, Dr. Miniaci, for your time today and sharing with the viewers your world of orthopedics, as well as Baptist Health Orthopedic Care at Baptist Health Southwest.